welcome you all for the topic, a talk on challenges and opportunities in healthcare sector after COVID-19. Myself, Dr. Rajkumar Bagli, Professor, HOD, Department of Pharmacology, Ashok Ramani College of Pharmacy, Pet Vadagaon. So, as you know my topic is consisting of COVID, coronavirus, as well as the healthcare opportunities. So, what is coronavirus? And right now everybody is aware about what do you mean by coronavirus. So it is a large family of virus which may cause illness in animals or humans. In humans there are several coronaviruses are present, that is MERS, SARS, and the most recently discovered coronavirus causes disease known as a COVID-19. So you are aware about the symptoms. Symptoms include cough, headache, fever, chills, congestion, as well as runny nose, and recently added new loss of loss of taste or smell, shortness of breath, difficulty in breathing, diarrhea, as well as muscle twitching, as well as itches, fatigue, nausea, vomiting, as well as sore throat, as well as cough, headache. These are the symptoms which are going to be there. So here few people are there which doesn't show any symptoms, and mostly 80% of the peoples they are not having that much symptoms, but out of 6 people, one is going to be admitted and he is going to be very serious ill, and he needs respiration help in the hospitals. So how the coronavirus is going to be transmitted? So it is transmitted from one individual to the different individuals by this particular help of diagram you can know aware. So droplets containing the microbes, they are spread in the air, and such droplets are inhaled by the healthy individuals, and because of that he may develop the COVID-19 infection. So these droplets can fall also on the objects, and these object containing particles, they are being touched by the another individuals, and such individual may inhale or may engulf such particles inside the body. Then how to prevent this particularly COVID-19 infections? So you are also taking care right now, everybody is taking care, that is avoiding the close contact, cleaning your hands often, be in the home, that is stay at homes, then cover cough as well as sneezes. At the time of doing that you have to take coverage, as well as always wear a face mask, clean and disinfect on the hand. So these are the precautions you can take for avoiding the corona infections. Then how to wear the mask. So what is the need of putting a mask? So here by the help of this particular slides you come to know how the mask will be helpful for prevention of the particularly diseases. So here it has been shown how the mask has to be worn and how it is going to protect for the community. Then about the incubation periods. So what do you mean by incubation periods? So incubation period, here the organism is present inside your body, but it will take a time to produce the symptoms. So people with COVID-19 generally develop signs and symptoms including mild respiratory symptoms and fever on an average of 5 to 6 days after infection. So once the organisms enter your body, within 5 to 6 days you are going to show the symptoms, and in a span of 1 to 14 days you will be called as a incubation periods. So if any person is going to spread the particles in the air, then for how much time it is going to be survive. So that's why it is going to be there called as how long does coronavirus it is going to be present on the surface. So on the copper it is going to be present for 4 hours, on a cardboard it is going to be present for 24 hours, on plastic it is going to be it is going to be there for 72 hours, on the stainless steel it is going to be maximum up to the 72 hours, and also in the air it remains for the 3 hours. So here I have collected the COVID-19 cases, what are going to be appearing in the world as well as what are going to be appearing in the different countries. So Russia, America is no doubt it is going to be in the top. Russia, India, presently India is having almost 6 lakh cases which are going to be there. Spain, France, Italy, Canada are also going to be there. So China is also going to be there here. Also I have mentioned about the graph. In that graph you are going to see how many confirmed cases of the COVID-19 deaths are going to be there, and leading is going to be America. So it is containing 120,000, so 1,20,000, or you can say 1,20,000 deaths are going to be there in the Americas, and India is presently is in the range of 18 to 20,000 deaths per day on today. So now this is about, we are speaking about the COVID-19, it is about the infections. So how the healthcare is responsible for this COVID-19. So my topic is the healthcare sector opportunities after COVID-19. So we should also aware about the what doing by the healthcare. So what is healthcare? So healthcare, it includes diagnosis. So diagnosis means to identify the disease, to diagnose the disease, to know the disease, that is called as diagnosis, to treat it. So we are going to treat that particular disease, and also we are going to prevent the disease. So prior to occurrence of the disease, we can prevent the disease. So all this contains, they are covered as a healthcare. So it is going to be diagnosis, treatment and prevention of disease, illness, injury and other physical as well as mental impairments which are going to occur in the humans. So who are going to be called as healthcare practitioners? So healthcare practitioners includes, or it is going to be delivered by the medicines, chiropractics, dentistry, nursing, pharmacy, allied health sciences as well as other care providers. They are all called as a healthcare practitioners. So what is healthcare? So you are aware about the healthcare. So when you see about the India, so India, it is going to be the largest healthcare sector both in terms of revenue as well as employment. So what the healthcare comprises? It comprises the large number of hospitals, medical devices, clinical trials, outsourcing, telemedicines, medical tourism, health insurance as well as medical equipments. So India is ranking 145th among the 195 countries in terms of quality and accessibility of the healthcare. So India is carrying almost 1/10 of the surgeries cheaper than the other Western countries as well as US countries. So by the help of this graph, you are coming to know that 71% of the revenue is going to be generated by the hospitals, and remaining is going to be generated by the pharmaceuticals, medical equipment as well as medical insurance and diagnostic areas. So what is the importance of the healthcare industry? So why we should consider or concentrate about the healthcare industry? So aging populations and increasingly prevalent chronic diseases we are going to see in the India more, and because of that as well as the lifestyles of the individual, all boosting the healthcare industry to grow. Then what is the impact of the healthcare industry on the economy? So it is the fastest growing industry, healthcare industry is in the world. 10% of the GDP of most developed nation comprises of the healthcare industry. Some of the large developing economies such as Brazil, India, China and Russia, they spend very less amount of the GDP on the healthcare, and when you compare with the other countries, that is United States as well as France. So these are about what the advantage our country India is having. So there is a strong demand as well as attractive opportunities as well as rising manpower in the India. So for example, I'll tell about in 2010 there are only 827,006 number of the physicians were there, doctors were there, but right now it is going to be increased to double in the 2018. So the more number of the doctors have been increased in the meantime. Then also the policy support by the government, all is going to be showing the advantage to the particular health sectors in the India. So also it takes into consideration about the investment which is done by the government. So the hospital and diagnostic centers attracted every year worth US dollars of 6.625 billions between a span of 20 years. So these are some of the recent investment you are going to see in the Indian healthcare industry. So Fortis Healthcare as well as Microsoft India as well as National Law Tribunals as well as we can say healthcare sector in India, all as well as India and Cuba has made an MOU, and also you are going to see merger and acquisition deals in hospital sector are jumped by 155%, and in terms of the what you can say amount, it is going to be 7,615 crore when you are going to see in the last financial year. Then also the opportunities always created because of the government initiatives. So what the government has, present government, what the initiatives they have taken for boosting the healthcare sectors. So they have launched the Pradhan Mantri Jan Arogya Yojana to provide the health insurance to the every individuals. They also approved the Ayushman Bharat National Health Protection Mission in the last 2 years back, August 2018. Also the US dollar 5.09 billion nutrition related program has been established by the government in the present financial year, as well as also for the healthcare sector the 69,000 crore has been invested by the Indian government, aims also to increase the healthcare spending by 3% of the GDP by in the upcoming 2 years. Then also established the new AIMS at the what you can say Haryana state. Also approved the setting of the National Nutrition Mission. So these all are contributing for the enrichment of the particularly government initiatives. Then next one is about the achievements. So what the achievements our Indian government is done. So according to the sample registration system in the bulletin 2016, India has registered a 26.9% reduction in the maternal mortality ratio. So it was initially the maternal mortality ratio is high, but now because of the government initiatives achievement, it has been come down, that is 26.9%. Around 125.7 million families have been enrolled as a beneficiaries under the Pradhan Mantri Jan Arogya Yojana. And here you are going to see there are more number of private hospitals, public hospitals, they all are included in the particularly PMJAY scheme. About 50 lakh people have received free treatment under the Ayushman Bharat scheme. Also the number of medical colleges in the India is increased to the number 529 in the financial year 19 from the 381 which was in the 6 years back in the 2013. So what are the challenges in the healthcare sectors? So population. So India is at present running 1.38 billion populations. So that was the main driving force for the healthcare sector to grow. Also the infrastructures, when you see the comparisons in between the what you can say rural community as well as hospital beds, you are going to see the difference, that is 81% shortage of specialists in the rural community as well as in the what you can say private sectors, it is 63% is shortage is going to be there, as well as there is a large number of disparity in between the rural area as well as urban area. As the professionals, they are concentrated more in the urban areas and they doesn't want to go to the urban in the rural areas. That was also the challenge we are going to spread. Also the low government spending by the governments. So on health accounts only 1.2%, which is low when you compare the WHO recommendation 5%. So WHO says says that government spending should be 5%, but in our country only 1.2% spending is going to be there, as well as high out of pocket expenditure, which is much in India when you compare with the other countries. So 62% of the population of the 62% of the expenditure has to be paid by the individuals. When you compare 13.4% has to be paid by the individuals and rest is going to be paid by the insurance in the other countries. So that has to be taken into considerations. Also when you see the insurance, 76% of the Indians that doesn't have the health insurance, and government is merely putting insurance of only 32%. Also, there are disease burdens are going to be there. No doubt in India, maternal infant mortality, communicable diseases are also going to be more. Apart from that, nowadays, because of urbanizations, you are going to see the disease burden of hypertension and diabetes, which is going to be arise, as well as inadequate attention has been given to the other practices such as homeopathy, Ayurveda, as well as Unani Pharma. So, opportunities. So, what are the opportunities we are going to see? So, increasing the public expenditure on health to the 2.5% is also going to be opportunities. Focusing on a primary health care. Focus should be shifted to the preventive health care rather than curative health care. So, preventive means we should take care that the disease should not occur instead of curing the disease laterwards. So, if you go for the preventive health care, so we are going to get more opportunities. Also, the private investment, education institutions should be encouraged. Establishment of Ministry of Ayush provide the opportunity to explore alternative medical practices, as well as the benefits of our advanced information technology India's hub. That is, we can have the different what you can say application. That is, right now we have the Swasth Bharat mobile application, Anmol ANM mobile application, e-Raktakosh application, as well as India Fight Dengue. These applications are available, and these all contributes for the opportunities in the India. So basically, we are going to see about how the pharma sector opportunities are going to be there more. So this is about the pharmaceuticals, healthcare sectors, how it is going to be contribute. So when you see the pharma sectors, it comprises of the medicines which are available on the drug, which is available on the OTC, that is called as over-the-counter drug, and drug stores. Also the the physicians prescribe the drugs, prescription drugs are available. Then biopharmaceutical drugs are available. Dietary fibers, supplement manufacturing is there. Cup and cold medicine manufacturing, vitamin supplement manufacturing, generic drugs, pharmaceuticals packing and labeling services are also there. Health stores are also there, as well as eyeglasses and contact lens stores. So these are all are going to be a pharmaceutical what you can say opportunities which are going to be established, which are going to be there in the India. So now this is about the healthcare sectors. Now we will correlate both the things. will correlate the COVID-19 as well as the healthcare sector's opportunities, and we'll see how the challenges are going to face in the upcoming days. So this is a list of the epidemic as well as pandemic diseases which are occurred prior to this corona infection. So there are number of infections are going to be there, that is plague is there, smallpox is there, as well as cholera is there, influenza is there, as well as influenza, HIV, AIDS, SARS, swine flu, MERS, as well as the Zika virus are going to be there. So all these are going to be, these are the diseases which are occurred in the last years, few years back only. So how to curtail that? So the best defense against any outbreak is a strong health systems. So COVID-19 is prevailing how fragile many of the world's health systems and services are, forcing countries to make difficult choice on how to best meet the needs of their peoples. So we have to take care our available resources in all the countries. So no country is right now is well prepared for the COVID infections. So governments of different countries are reacting differently because it is going to be a new first times they are suffering this much a large number of peoples. So on one side we are going to see extreme, that is they are being advised to follow social distancing and certain other precautions, as well as life is going normal. But in some countries like India, which we have seen few days back, the lockdown is going to be there. So one is applying the lockdown and one has not applying the lockdown. So such differences you are going to see right now in the whole world, as well as an epidemic of this proportion needs a certain infrastructures to deal with, and none of the countries is having that much available resources or infrastructures. So what sectors which are going to bright after the COVID-19? So these are the sectors which are making a tremendous growth in the upcoming days. So which list a few: education, e-retail, BFSI, as well as medical, as well as IT sectors. We'll see one by one. So educations. So right now, so in all colleges, in all the institutions, you are going to see the online learning is going to be done in all the way. But prior to these infections, nobody has thought about the educations by the online systems. So education is going to be changing in upcoming days. Next one is also the e-retails. So prior to that, nobody is going to doing the e-retails, but because of COVID infections, everybody wants to follow the social distancing, so they are ordering their materials by the e-retail process. So that is also going to be changed. Then also the banking, finance services, as well as insurance sector, this is also going to be changed in the upcoming days. Then medicals. So this is going to be a very important one, as people adopt better personal hygiene practices in the post-COVID-19 world. So because of that, you are going to see nowadays there is a consumption of nutrition and wellness products has been high. Products like disinfectants as well as sanitizers has been tremendously increased. Fitness products, we are going to see gadgets and applications are going to be used by the more number of healthcare awares. Then online medium provisions like online medicine delivery as well as teleconsulting has been improved a lot. Also about the IT as well as ITEs. So you are going to see right now there is a drop of the IT as well as ITEs. But when you look back in the upcoming days, we can go further. So we have to prepare them to capitalize such digital opportunities that will come knocking at their doors once the world goes to the digitals. So what is COVID-19, how it is going to affect to the individuals? So COVID-19 is a disruptive catalyst which is going to be seen in every industry. So this pandemic is set to reshape the healthcare industry with cutting edge technologies such as Internet of Medical Things, teleradiology, telemedicines, remote patient monitoring, as well as virtual images you are going to see in the upcoming days. So initially there is a forecast of previous slide. There is a forecast of 32% of the annual growth, but because of these particular infections, suddenly there is a boost of 64, almost double. What you can say, you are going to see the increase in the all such what you can say the care techniques have been improved. So these are the growth opportunities which are going to see in the healthcare, life sciences, digital health, advanced medical technology, as well as medical imaging. It has been seen in nowadays. So now we'll see what boom is going to be created in the upcoming days. So personal hygiene. So what does personal hygiene mean? So personal hygiene includes intimate care wipes, anti-chapping creams for the men, sweat patches, sanitary napkins, urination devices, disposable towels, gloves, oral cares. So these are all what I can say the market is been about to increase. So you see when it is going to be 19, it is going to be just $11.5 billion US dollars, but within 2 to 3 years, it is going to be increasing by 25%. So for one example, so what you can say, the Vikas Bagaria, who is the founder of the Peace Safe, he says that there was not much demand from the general public prior to this COVID outbreaks. But however, this has increased sharply now because of the COVID-19 infections. So what he says, it will be held up to 2,000 crore by the year 2025 by the sanitizer. So sanitizer is going to be a tremendous growth because of the taking the awareness of all the individuals. So these are the, what you can say, graphs. You are going to see how the personal care market is going to be there in the total market, in the total, what you can say, the care market values. So here personal care market value is crossed the different values. So we are going to be total, and out of total personal care is going to be more in the all the years. So slowly it is increasing, as well as personal care products witnessing steady ARPU growth over the years. So here slowly there is a personal care products is going to be sold more in the numbers. So also here see personal hygiene products are trending out the Google. So when you see the Googles, so the trend, what you can say, there is a search for the particularly mask you are going to be seeing in those particular days. So that it has been seen in the slides. In December there is very less searching for the mask is there. In 2000 January it is going to be somewhat more, but when the India it has been forced for the lockdown in the March month, you are going to see there is a tremendous increase in the wearing of the face masks, and because of that there is an increase in the, what you can say, the purchase of the trendings. Also here are also going to be say hand sanitizers, how they are available. So initially it was available comparatively good in the Indian country, but when the outbreak has been followed, so suddenly nobody is going to get the sanitizers. So increased demand for personal hygiene products are you are going to see, and because of that there is in the future, in the upcoming days, you are going to see more startups and brands are going to emerge. That is public toilets and sanitation facilities, shower areas, baby products and female care products are going to be increased. So one more example, what the Devesh should say, who is the founder of the P-Uri, which makes urination aid for the woman, remarked the demand will remain high as people don't want to compromise with their personal hygiene. So nowadays nobody want to affect their personal hygiene because of the particularly COVID infections. So products like bamboo sanitary pads, stands, as well as pee funnels will get good demand in the market, as everyone will be trying to avoid common washrooms or direct contact with toilet seats in the colleges, offices, hospitals. So this is an example how in the upcoming days the market is going to be improved here. So what is going to be changed because of the COVID infections? So no doubt nowadays you are going to aware that is there is a very tremendous toll, that is unprecedented toll on the healthcare workers. So it has been healthcare workers, our what you can say, the god we can say, they are facing a lot more, what you can say, problems. So they have been overburdened because of the patient inflow. Also you are going to see that is diminishing trust in the globalized world. So pre-COVID and post-COVID you are going to see. Pre-COVID we are mixing with everybody, but nowadays we want to keep the social distancing so that we should not get affected from that particular individual. So that is going to be changed in the upcoming days, and also focus on the healthcare system. So because of the infections, the healthcare system focus is going to be more. So these will be needed to ensure a safe environment for the personnel and patients, as well as to better cope up with any emergency situations which is going to arise later. As well as this is one new informations we are going to be available, that is new travel documents. So if you are free from COVID-19, you are allowed to travel anywhere, and if you are not having the COVID-19 test, you are subjected to be restricted to be in that particular area only. So if you are certified to be immune to the virus, you will get a pass to resume your daily routine, and if not, you will have to stay indoors or in the homes. As well as nobody wants to do the surveillance, but it is a essential part. It is going to be there because of the COVID-19 infections. So surveillance as ongoing public health measures you are going to be seen by the different governments. As well as you have to adopt the different habits, brand new habits. Awareness for personal and public hygiene are going to be more, you are going to see. So everybody has to follow the, what you can say, the guidelines. So they have to wash their hands for at least 20 seconds, distancing has to be made, as well as face masks has to be applied for in case of any shopping. So certain aspect of healthcare should change to better attend in our post-pandemic needs, such as artificial intelligence is a necessary tool, has to be developed in the upcoming days. A shift in the point of cares. So initially, patient has to supposed to go to the physician's door, but nowadays all the things we can do with by the sitting in our home only by using the advanced technology. So here you are going to see, by using the advanced technology we can give the readings of our ECG, as well as what you can say ultrasound, as well as the different observations we can give it to the physicians, and from their sittings only they can advise what type of medicines can be taken. As well as sustainable solutions were to found to remain in the planet. We are allowed to experiment with the digital solutions, be it virtual meetings for work, digital education for students, and virtual events instead of in a personal conference. So there is no need of going in front of the physicians. So we can have the data giving to the physicians. So by sitting in the what you can say dispensary, the physicians can monitor your what you can say the all the health related issues. So there are 10 business ideas which are to be worth investing amidst the COVID-19. So pickup and delivery. So you are aware. So nowadays nobody goes in the shops. So they order it from the different online mediums, and the online medium from those stores, all the materials have been dropped into your doorsteps, and online education has been started. So that is also going to be changed in the future. Grocery delivery as well as medicine delivery, it has to be done in your home care, in the home regions, as well as healthcare consultations. So you need not have to reach to the physicians directly. So digitally you can connect with him. By giving all the values, you can get the informations at your doorstep. As well as also on-demand doctors, nurses and caretakers. So 70% of the increase in consultations you are going to be seen after the COVID-19 attack. So hence developing a platform where users can seek on-demand doctors, nurses and even other healthcare service providers seems to be a future-proof idea. So by sitting in a house, we can ask the doctors, nurses as well as caretaker advice in the house. So as well as e-commerce marketplace. So these are the e-commerce which you can say different, what you can say planets are available. By them we can purchase anything and which are delivered at your doorstep. As well as fitness and wellness app are going to be there. Digital platforms have turned to be a blessings in the disguise for the health and fitness industries. So from online training apps to yoga, meditation apps, as well as the what you can say exercise apps are going to be downloaded, and every individual is going to do their training as well as the what you can say wellness workout in their home only. As well as also drone delivery as well as robots are used to fight off the virus and deliver services and care to those isolated or following the social distancing. And one more is there, online medical van booking. So we can book the medical vans, so that online ambulance or medical van booking app are available, so which have triggered medical commerce boom. So this is about the things. Okay, so this is going to be seen. So as the COVID-19 infection is going to be begins, so nowadays we are going to see a different type of masks are available. So as the world is facing a severe pandemic, the mask market is on the rise. Since they cover half of the face, the demand for the creativity and designs you are seeing in the marketplace. So in future, in the upcoming days, there is a what you can say the apparel brands, known apparel brands might start their own manufacturing masks, especially luxury as well as designer brands. These are the examples. You are going to see how the masks are now changed. As well as also the vending machines. So as the world is facing a severe pandemic, vending machines. So vending machine where you are supposed to put money, you are supposed to swipe your cards, and you are going to get the things which are going to be needed. So there is a social distancing is also followed, as well as the sanitation is also done of that particular instrument, so that nobody is going to get infected. So in the upcoming days, you are going to see vending machine sale is going to be increased. Also, estimates indicate that India supplies up to 50% of the United States generic drugs needs, and vulnerabilities caused by the COVID-19, you are going to see there is a disruption. So India will have the good opportunity to reassess dependencies and plan for the futures. So according to the government of India own estimates, India ranks 3rd worldwide for the pharmaceutical productions by the volume and 13% by the value. So what it indicates? India is a role as the pharmacy of the world is well acknowledged by the experts. So here this is an updated information daily how much we need the things. So every month frontline health responders around the world needs these supplies. So need 89 million masks, 13 million goggles, 76 million gloves, 2.9 million liter hand sanitizers is needed. This is the information which is presented by the WHO 1 or 2 months back. So nowadays it has been increased. So what are the takeaways? Of this particular my talk? So, or we can say as a conclusions. So the healthcare sector lagged in 2019 principally because of the uncertainty surroundings. But in the second and third quarter of 2020, demand for the elective medical procedures should drop but may return more quickly than other consumer sectors. So COVID-19 may change some of the sector leaders. Companies associated with creating point of care diagnostics and patient monitoring innovations may see a boost in demands. In the long term, the healthcare industry is moving toward a pay for value systems and not for a fee for service models. So with this brief, you can say talk, I will conclude my talk. Thank you.